This is Guardian Radio, your station for up-to-the-minute news, intelligent, interactive, and engaging conversation. 96.9 FM. The views and opinions of the hosts and guests are their own and do not necessarily reflect the position of the management and staff of Guardian Network.
Good night and welcome to The Doctor is In with me, Dr. Jennifer Archer. Thank you for joining us for another exciting show on this Tuesday evening on Guardian Radio 96.9 for all things health, wellness, and things that pertain to the Bahamian society. We have another exciting show that we have tonight. We're going to talk a little bit about a few different topics, and then we're also going to talk about just in general respiratory illnesses. There's been quite a rise. It's the season. And we're post-COVID, so a lot of things are happening. Of course, today's show is brought to you by Medical Concierge Services for all your medical care needs. We are a family medicine clinic. You can find us on Collins Avenue in the Bahamas Heart Center, and we see everyone, children, adults, persons of all ages. So we have general practice services as well as medical concierge services. So if you need us to come to your home, you need a doctor to come and check on you, just give us a call. And we have a variety of other services as well, such as microneedling and IV vitamins. And coming soon, we're going to be doing Botox as well in the clinic, so you can call and find out more about that. How do you reach us? 326-1521. Or we do have a new WhatsApp line. So if you're using the old WhatsApp line, we're no longer using that. The number is 432-4010. And you can use that line to contact us, find out if you can get an appointment, because we are an appointment-based clinic. And also, of course, for those of you trying to sign up for NHI, we can still do that for you there. So if you send us a message, I want to sign up for NHI, we can get your information and get you started. So once again, welcome to the show tonight. Sorry about last week, wasn't here. Sadly, I had a childhood friend that passed away, and that brought back a lot of feelings from my youth. And, I had to go to the funeral and everything like that. So these are trying times, and people, no matter their age, can pass away. And so I really kind of felt that. And so I feel for everyone that has lost any loved ones, friends, or family recently. It's something difficult that we have to deal with in life, and especially when persons are extremely young or fairly young, it can be very difficult to really kind of understand about all of that. A lot of other things happen. We're just going to touch lightly on some things that happen in terms of news around the world, in terms of health news. And very interestingly, some things are happening in the U.S. New York State judge reinstates fired workers who didn't comply with New York mandates. So they had a ruling recently that certain workers who had been fired kind of during the whole COVID saga because they weren't vaccinated. They basically kind of won the case. So that case has set precedents for people to get their jobs back and to get their back pay. And so that is a very interesting that's happening with all of that. And it's happening, surprisingly, in New York City. And so 16 fired sanitation workers actually who didn't comply to the mandates got their back pay. And they're going to probably be reinstated as well. So for those of you keeping up with what's happening there, that's quite interesting. What's happening in New York. And so that ruling has really kind of changed a lot of things in terms of people and, suing for their rights as it pertains to everything that happened with COVID-19. So that was one of the most interesting stories kind of coming out of the U.S. And what is big right now, and everyone may have realized it because I'm sure there's someone around you that has been sick, who's been coughing, that's been, not feeling well, especially with the children. We've seen a really high rise in respiratory viruses that are not COVID related. And so we're back out there. Kids are back out into the regular community. They've been in for almost 2 years. And what we're seeing is that their immune systems may not have, really been pressured very much. And so we're seeing a lot of respiratory illnesses that are not COVID. And they're testing them. They're not COVID. They're coming out to be things like RSV and influenza and other strains of viruses that we really haven't been looking at or talking about in the last few years. And so we're going to listen to a little clip about what's going on in the U.S. with all of these respiratory cases. And similarly in the Bahamas, we can see that it's also happening here as well. And we're going to talk about respiratory illness and what you can do to keep yourself safe, keep your kids safe, what you should look out for, and when should you really come to the doctor? Because you have a lot of people that come, they don't really need the doctor too much, but then some people don't come quick enough. So we're going to talk about those things as well. So we're going to take a look at what components of a respiratory illness really is concerning, and how do we differentiate between just like a cold and a flu and something more serious like a pneumonia, which can cause you to be hospitalized and make you very ill, and when you would need antibiotics or not. And so not all of these respiratory illnesses require antibiotics because a lot of them are viral. And so, Mr. Producer, if you're able to play the clip, I would like you to play the clip right now, just on what's happening in the U.S. in terms of respiratory viruses. So if you have that clip ready, you can go ahead. And if we're not ready, just please let me know. So as you have the clip ready, you can play that right away for me.
Good evening, and it's great to have you with us here on a Thursday night. The political earthquake in London, the stunning turn, the Prime Minister out after just 45 days. But we begin here at home tonight with the alarming rise in the number of children hospitalized with respiratory illnesses across this country. 34 states seeing the spike in cases. It's not COVID. So, of course, the question, what is driving this? The National Guard visiting one Connecticut hospital today, considering plans for a mobile field hospital. As you can see across the map, hospitals in at least 34 states now are reporting this surge in children sick with the virus RSV, with the flu, and with other viruses as well. 71% of the nation's 40,000 pediatric hospital beds are now filled. That's the highest number in 2 years. Hospitals considering how to handle the overflow, emergency rooms struggling to keep up, some treating children in the hallways of the hospital. And authorities believe in part that after masks and social distancing, young children staying home from daycare during COVID, some are now being exposed to viruses for the first time in a very long time. ABC's Ariel Reshef tonight leading us off.
With that surge in child respiratory viruses, tonight hospitals pushed to the brink. 71% of pediatric beds across the country are now filled, the highest level in 2 years. And many parents like Amanda Bentley want to warn other families. Her 18-month-old son Joshua has been in the hospital with RSV for more than a week.
Really high fevers, difficulty breathing. It was a lot of work to breathe. He would cough until he vomited.
Hospitals in at least 34 states are treating a crush of children sick with RSV, flu, and other viruses. Connecticut Children's in Hartford is scrambling to treat patients in hallways while they consider a plan with FEMA and the National Guard to set up a surge tent outside.
We're seeing patients in every available space possible. So we will do whatever it takes to take care of the patients wherever we can have them.
Experts say parents should take their kids to the doctor or ER if they see signs of respiratory distress, like fast or labored breathing, a fever, or blue or discolored skin on the face, signaling low oxygen. And while it's not COVID, doctors say one reason for the uptick is that during the pandemic, children weren't as exposed to viruses because of masking and social distancing.
Ariel Reshef joining us here live tonight. And Ariel, makes a lot of sense that these doctors say that many of these cases they're seeing are more severe because kids haven't been exposed in quite the same way these last couple of years because of all the social distancing, keeping them home in some cases. Obviously, for parents at home, grandparents watching tonight, what should they look for here?
Yeah, really important, David. Doctors say that they are seeing these cases earlier in the season, and as you mentioned, some are more severe, so doctors are urging parents to look out for signs that their children may be straining to breathe, like flaring their nostrils or wheezing. David? Ariel Reshef leading us off on this important story again tonight. Ariel, thank you.
Okay, thank you, producer. I don't know, that was me earlier that kind of did some weird stuff there. Yeah, but if this was actually an ABC report, they were looking at these all these cases and hospitalizations of children. As you remember, throughout COVID, we didn't really have a lot of children involved. Usually we see that kids are more prone to the common cold or flu-like symptoms rather than COVID. And so with COVID kind of going away, the refocus on and opening back up, you see a lot of kids with these respiratory problems. And the cases, some of them are a little bit more extreme than expected. Note that what the reporters said is that what they're thinking the cause of all of this is because the kids have been social distancing, masked, and just out of the regular environment for the past few years. And so we can see that some of the policies that we've talked about in the past that we said would cause some problems are in fact, once again, affecting the children. I do say this because, I've always advocated that we remove the mask from the children, and we are having a really abundance of cases here in the Bahamas as well. And so that's something that should also be looking into why we're having an elevated number of respiratory cases in children. And if it's related to social distance and masking, then we need to take another approach to our policies, in particular with kids. So that was what's going on in the U.S. So that's why tonight we're really going to talk about respiratory illnesses, upper and lower respiratory illnesses, and kind of explore what does that mean and what should we look out for. So first of all, respiratory illnesses can be both upper and lower respiratory. It's any illness that affects the respiratory tract. And what people don't realize is the respiratory tract starts all the way up from the sinuses and the nostrils, all the way down what we call the windpipe, and down into the lungs and the bronchus and the bronchioles. So all those departments all consist of the airways. Even there is a connection with those areas into the air canals, so into the ears. There are pathways there. And so people can get affected in all those different areas in terms of respiratory illnesses. Now, what's really common is what we call the upper respiratory illnesses, because they can be the sinuses and the throat. So if you have a sore throat or you have congestion, those would be your upper respiratory tract infections. In fact, the common cold, what we call epiglottitis, which is the epiglottis right in the back of the throat, the larynx or the throat itself as it goes down, the pharynx and the sinus and any kind of sinusitis, we all categorize those as upper respiratory tract infections. When we look at our lower respiratory tract infections, we're talking about the lower airways and the lungs. And in general, these tend to last a lot longer, and they tend to be more severe and more infectious. So things like bronchitis, which is a lung infection and involves coughing and fever, bronchiolitis, which is a lung infection that affects mostly young children, any kind of chest infection, or what everybody knows as pneumonia, which is actually an infection in the lung parenchyma or the lung itself. And so what really causes these infections, it can be viral or it can be bacterial. And if any one of those infects any part of the airway, then you can get a respiratory infection. So if you were to perhaps touch an infected surface, or you shake hands with someone who's just sneezed into their hand, and you would put that to your nose or your mouth, or if you were just to inhale those germs by, someone coughing on you, that can enter your body. And that's how the common cold and the flus and even the pneumonias are spread. So we've known about these infections for many, many years. And so these infections are really, really common, and anyone can basically catch them. But some people would be more at risk than others. And those persons at risk are usually children, which was why COVID was very unusual, because we didn't see that in children. But the other persons who were at risk usually for these viral infections would be our elderly persons who are ill, who are persons who have problems with their immune system and who aren't able to fight germs as easily. And we know even as children, we catch coughs and colds all the time. And as we get older, we're less likely to really get affected by those things the way we did as a kid. And so we also see people that have any kind of lung function problems also being more readily affected by upper and lower respiratory tract infections. And those people with immune deficiencies may get very severe disease with something which would be mild in a regular person. And so how do we diagnose these infections? Well, when you go to your doctor, the doctor will ask you a multitude of questions. You'll probably come in with some symptomatology, and we will do a physical exam as needed. And they'll look at your nose, sometimes in your throat, to see maybe if there is obvious signs of infection. And if it's something a little bit more serious or something that can't be seen, we can sometimes order a lung x-ray, a CT scan, or some type of pulmonary functioning test. Sometimes we take swabs, and sometimes they will even test your sputum. And so all these different tests can be used in a variety of different ways in order to kind of figure out if you have an infection or not. And so is this contagious? Yes, we know that upper respiratory tract infections are very contagious. They pass from person to person, from droplets or from hand-to-hand contact. And people with upper respiratory tract infections can pass this on to others through sneezing and coughing, where the droplets get into the air or they get onto the surface or onto a mucous membrane. So your nose, your mouth, or even your eyes. So what are the symptoms? Commonly, we know that the symptoms are cough and fever. Some persons get a very hoarse voice. They can lack energy or fatigue. Red eyes can be a part of that. Runny nose, sore throat, and even swollen lymph nodes. So a lot of people, especially if it's an upper respiratory tract infection, will say that I have a lymph node maybe in my neck or near to my ear, and it's swollen, so they'll have a little line. Sometimes this can also be quite painful, and it takes a little while to go away. And so how long does it last? Now, when we were training in school, they would say, most colds and flus last about 5 or 7 days, and they tend to go away. I find that even common colds and the simple flus tend to be lasting a lot longer these days. And so 1 to 2 weeks can be typical, and most of the time they will go away on their own. So in most cases, people won't need any medication, or they can take over-the-counter medication. I like the Tylenol Cold and Flu, not to advertise for them, but the Tylenol Cold Severe and Flu if you're going to do something over the counter. But that really should be your first kind of step to see if you can get over it, is to kind of take something over the counter. Now, if your symptoms are lasting more than 2 weeks, you really should talk to your doctor, because it might be something else that's going on. And you want to ensure that you have a pneumonia or a bronchitis, which is a lower lung disease, a lower respiratory tract infection, because that can be quite severe. So most time these viruses that cause respiratory infections, just over time your body is able to fight that off, and you don't really need antibiotics. So one of the things when I first started practicing medicine about 13 years ago, people would always kind of want antibiotics. So a lot of education would need to be done to realize that not all the time antibiotics is the answer, especially when it's very likely that the infection is just a viral one. So you just want to treat your symptoms at home. You want to get pain relievers to relieve any pain that you may have. You want to rest. You want to drink lots of fluids. And if you have a bacterial infection, such as strep throat or something that's more severe, then you can go into the doctor and they will prescribe some antibiotics. And that's why sometimes we require doing a swab because that's when it would be needed. And so when should you really see a healthcare provider? When is it kind of the tipping point that, hey, I need to go in and see a doctor? Well, if you start having any kind of extreme symptoms. So for like adults, if your temperature is running extremely high, books say 103, but even at about 102, I would start to think, and especially if you can't get the fever to go down, that you really need to see someone because an extremely high fever can cause a lot of problems. In children, high fevers can lead to febrile seizures and just a lot of really nasty stuff. So fevers are an indication that your body is fighting an infection. And when the fever goes up high and it doesn't come back down, you're kind of losing a little bit. So you want to get the fever down because in that battle to fight that infection, you can create a lot of other problems for yourself. So a very high fever. So with this being kind of flu season, respiratory season, and with the increased cases, I advise everyone to have a thermometer in their house. So you want to have a thermometer in your house because it's one thing to say subjectively that, I think my temperature is up, I'm not too sure, but it gives the doctor a lot more information. If you can say my temperature is 101, 102, and that kind of lets us know how severe things are or the direction that we need to go. And might even determine which medication you're on. If there's any blacking out or loss of consciousness, for sure, you're going to go and be seen. If you're having rapid or difficult breathing, so if you feel like it's getting hard to breathe or you're breathing quite quickly, you want to go in and see a doctor, maybe even go to the emergency room. If you're having a frequently severe coughing, which may come with vomiting, so if you're coughing, and you can't stop coughing until you're vomiting, you might want to come in and see what you can do. Sometimes if you have a lot of vomiting or you're feeling really unwell and you cannot take fluids properly, you may need to be rehydrated. We have a lot of patients that come in that need rehydration. And once they're rehydrated, they feel a lot better and they can actually start tolerating fluids. And sometimes you also can get medication, which will make your stomach feel better because being able to tolerate fluids and being able to eat will probably keep you out of hospital if you're having really severe coughing spells or vomiting. So you want to do that. If you are wheezing, so if your cough or your sound of your breathing doesn't sound normal and it sounds really high pitched or like a whistle, this is something we call wheezing. And this happens lower inside of the lungs. And it tells us that the little sacs that hold the air, some of them have kind of closed down and there's a lot of pressure that's required to open them up. So if you're having this wheezing or this whistling sound, you want to come in. And it's better to be safe than sorry because, you don't want to be wheezing and then end up short of breath. So some people do, though, take wheezing for what we call transmitted sounds, which is noises that are made from someone breathing through a congested nostril. And we can tell the difference between that when we put our stethoscope on your chest. We're able to tell if that sound is coming from an upper region, whether that sound is coming from a lower region, and if we should be concerned and you need any additional medication. So if you think you're wheezing, you want to come in and make sure that's not an abnormal breathing sound. If you're having retractions, which is you're breathing so deeply that you can see a change in your chest. You can see the depth of your chest moving in and out. Because if you look normally, if you're breathing, but it's not so much to the point where you have this great reduction in your chest volume or height. And so if you realize you're sucking in a lot of air and it's going into your chest, that may be a sign that, breathing is really becoming difficult for you. And, unlike maybe the fast breathing, you might think, well, I'm just having to take deep breaths. but usually that means that you're acquiring a lot of pressure to get air into the lungs. And then another sound you want to listen out for, and usually in children especially, is stridor, which is a very heartbeat, raspy, vibrating sound when you breathe, and you sound like a seal. So people say like you're barking like a seal. That sound is an indication of stridor that can be quite dangerous, and sometimes it's more common in children. So you want to bring the kids in and see if, because a particular type of infection is related to that, and then you also want to make sure that your airway is really nice and patent. So those are the big signs that you should come in. I just want to add in there, if you're not tolerating any food or liquids, if your appetite is to the point where you're not taking anything in, this can be very dangerous, because dehydration can lead to a lot of problems, including like palpitations, and can cause you to have other oxygenation issues. So you really want to make sure that you're being hydrated as much as possible. So if someone also is even if they haven't lost consciousness and they are extremely lethargic, which is you're not maybe responding very well, and they just seem very dazed and kind of unsure, that's also a sign that it could be something else. That's, even if you don't see them in any respiratory distress, it's a possibility that could be. You really want to bring them in. And if you're really unsure about some of the stuff, even if you can't get to the clinic, you may want to go straight to A&E if you're having any of these really severe symptoms. So we'll look first at the different types, starting with the common cold. And the common cold is called the common cold because it is extremely common. And there are really various varieties of viruses, over 200, that are part of what we call the common cold. So it's not just one particular strain of anything. It is a multitude of different viruses that we all kind of lump together over the years that people have experienced that cause some of these symptoms. And you can get the common cold at really any age. And there's a wide range of symptoms. And it is spread through direct contact through the respiratory secretions, such as saliva, phlegm. So this lasts about 10 days, and though the cough can last up to 3 weeks. Now, the cough lasting long, and I always tell people, because a lot of people call in even after they've had COVID and said, well, my cough is still there. Cough is usually the last one to go. So if you've been very, very sick, or you had a pretty nasty cough, cold, flu, anything, the cough is usually the last thing to go. And it's usually irritating to people because they don't want to be coughing all over the place. But even when your cold or flu is kind of resolving and you're feeling better, some people may still have a little bit of residual cough for another week or two. So that's something to really kind of think about. For my patients, hydration to me is key. And getting out into, an open environment is really good for the lungs. And with my post-COVID patients who may have had post-COVID symptoms, we do talk about deep breathing exercises so the airway is up as well. But when you talk about mucus and secretions, hydration is going to be really good. Glutathione is going to be really good. So those things are going to really help. And so the complications of a common cold can lead to things like ear infections, eye infections, and even pneumonia. So they can develop into something a bit more if you're one of those persons that has high risk factors, or you kind of ignore some of the other things from before. And what we realize too is that something can start off as a viral infection, but because you're very ill, you can be susceptible to bacterial infections where you can have a bacteria on viral infection. And so if you feel like, wow, it's been about 5, 6, 7, 8, 9, 10 days, and I should be getting better, I'm actually getting worse, that's another opportunity to come in and see your physician. And so we treat that basically by treating the symptoms, your aches and your pains, staying hydrated, getting lots of rest, taking acetaminophen for your body aches and your fever. It's very important to get your temperature back to normal. So for a lot of people, I'm going to suggest that for about 48 hours, you're going to take your pain or fever relieving medication consistently 6 to 8 hours according to the directions for the first 38 hours and keep your thermometer on you. That's going to be a really good way of managing that. And of course, you want to get lots and lots of rest because the body tends to be able to heal itself and to fight infection really, really well when you're both hydrated and rested. So, some people, they're sick in their home and they're trying to do a lot of different things and they wonder why they don't get better. And this is part of the reason because your body really needs rest. You need to be producing those white blood cells. They need to be fighting the infection. And usually when you sleep and your body is well rested, using an extra amount of energy, you can focus on fighting that infection and getting well pretty soon. And that's why if you really take the instructions well, usually in about 3 or 4 days, you will tend to feel a lot better. And so the next one we want to talk about is your epiglottitis. And this is the top part of your trachea when you breathe. When you're breathing, it's all the way in the back of your mouth and it's at the base of your tongue. And we call it the epiglottitis is when the epiglottis gets inflamed. So when that area becomes inflamed from any kind of viral or bacterial infection, you can get sick. And this can sometimes be quite serious. And that epiglottis sometimes swells from inflammation and can end up leading to blocking your airway. So you might have trouble breathing. And so if you think someone has an epiglottitis, you want to get medical help as soon as possible. So those people present with difficulty breathing or difficulty swallowing. And so if you're at home, you're not feeling well, you're feeling something in the back of your throat, it might be painful. You feel like it's difficult to breathe or even to swallow. So it's painful to swallow. And you have a fever and with a sore throat, then you want to get that checked out because it might be a little bit more serious. And sometimes it can require treatment in hospital or a medical facility. So you want to also make sure that your oxygenation rates are up and your airway is properly protected, because if it really gets swollen and really bad, some people actually have to be intubated. And so you want to have supplemental oxygen on hand. So you really want to be in a place where you can be seen appropriately. They're going to recommend that you get some IV fluids and possibly antibiotics, and then maybe some steroids to reduce the swelling. So that can be fairly problematic if it's not caught early. We'll also talk about next, people would have probably heard about what a laryngitis is. And that's basically your voice box area. And when that becomes really inflamed, it can be so because of viruses in the upper airways. And that's what leads to a laryngitis. You can become very hoarse and you may not be able to talk, only at a very low volume. And this is where you lose your voice. So most people have experienced this at some point in time. And they said, I lost my voice. And we said, that's the proper name for it, or the medical name would be a laryngitis. Okay, we have a comment online. I wish I called you when I was so sick 5 weeks ago. My grandchildren passed on RSV and it whooped me. I was too sick to function. Next time I'm calling you. Thank you, Sheila Pritchard. I'm really open to helping. Yeah, give me a call. And yes, there are definitely things that you can do to try to get over it better and just to feel better, okay? And sometimes you do need a little IV fluid to get you going. And so with the laryngitis, persons can have fever, they can have difficulty swallowing, and they can have a sore throat. You want to discuss your options on what you want to do with your healthcare provider. And most likely with the laryngitis, you may not need antibiotics. It's usually viral, but we can usually tell by looking at the back of the throat if there's any bacteria that may be involved. So you really want to rest your voice. You don't want to do much speaking, and you're going to drink as much extra fluids as you can. And you want to breathe in some nice steam. So if you have a little steaming pot, that might be very helpful if you're having a sore throat. You want to use some cough suppressants, because some people will realize when their throat is really, really inflamed and they do a lot of coughing. Sometimes you can get a little bit of blood in the cough if you're coughing continuously. This fright when they kind of run in and be like, I'm coughing up blood. But it's usually just blood streaked, and it's because you're coughing a lot and the pressure probably and the inflammation causes the blood vessels there to just kind of pop a little bit. And so it may not may still not be anything that's super serious, but if you are kind of worried about that, we can always take a look. And so we do a lot of cough suppressants, over-the-counter medications for that. I do encourage lozenges if you're having some pain in the back of the throat. So also we're going to talk about the next one is your pharyngitis. And this is our typical sore throats that everyone kind of knows about. And this is usually caused by a virus, but sometimes this can be caused by a bacteria that we call Streptococcus. And that's why we call it strep throat. And it's very common in children between the ages of 5 and 15 years old. So a little less common and find it more inside of the kids. And you can have really severe throat pain, as well as difficulty swallowing and speaking. You can have ear pain related to this, and you can have tender lymph nodes in the neck area. And your tonsils will be quite red and swollen. So a good indication that you're having what we call a pharyngitis was if we look at your tonsils. The question is, will you see children like 3 and up? Yes. The interesting thing and why I'm truly a family physician is because I did start my career in pediatrics. So I spent 2 years doing pediatrics in the hospital from NICU all the way up to children and then eventually into adults. So I'm actually, my foundation is kids. And so you find that some doctors are a little bit afraid to touch children because, kids can be very complex and children usually require a lot more. But that's actually the beginning of my training was actually with children. I was kind of slated to be a pediatrician, but I wanted to go broader. So I did then go on to do adult medicine as well. So that's how my training got really, really well-rounded. And yes, seniors, being a family physician, we do an additional 4 years of training. So I'm answering questions that are online, and I guess I'll open the call lines as well. So we do geriatrics as a part of our training. So, and I think this is a good time to just kind of mention that's what makes family medicine a little bit different than, let's say, a GP, because a GP would have done his medical training and kind of stopped there. A family physician would take an additional 4 years to kind of do many specialties in each area. So we would go back to pediatrics, adult medicine, geriatrics, and all those other areas, and just really get more in-depth knowledge so that we can really be, so that's what they call family medicine doctors, the gatekeepers of health, because we're almost like a specialist in each area. So we do have to do quite a bit more training, and we do a lot of research and clinical management to kind of make us a really well-rounded specialist, if you want to look at it like that. So we are specialists. So yes, thank you for those questions. Yes, I think it's important because I always get this kind of question, can you see everybody? What is a family medicine doctor? How is that different from a GP? And that's kind of what it is that additional 4 years of specialty training. And then most of us already had years of training in other areas where we started, such as pediatrics for myself. Some of our doctors would have come from adult medicine. And so we do have foundations specifically in different areas. So yeah, and I do love kids. Why I couldn't stay too much on the word with kids. I think being in the hospital and seeing kids, very young children, like passing away, I'm really a softie when it comes to that kind of stuff. And it would be hard on me to see terminally ill kids in the hospital. So I would tear up. And so, no, I could not take too much pediatrics inside of the hospital because I'm a softie. So I'd rather be able to see them early, make them better, and, send them home back to their parents on their way. So that kind of covers the major talking about. And so I guess we'll talk a little bit about lower respiratory tract infections. But because I've been taking questions online, I will open the phone lines on the airways in case anyone has any particular questions that I would have missed. So you can give us a call, 325-4259 and 322-6232 in case you want to make a comment or ask a question about our topic. So I think it's a good time to take a quick little break. We'll be right back on The Doctor Is In, and we're going to talk about your lower tract infections and what you should look about if you think you might have a pneumonia or a bronchitis. All right, so we'll be right back on The Doctor Is In with me, Dr. D. Archer.
Love the show? Want to give your support? Become a sponsor today. Call 302-2300 for our rates and packages. That's 302-2300. Become a sponsor on Guardian Radio 96.9 FM. Fresh news, smart talk, all day.
The Access Accelerator Small Business Development Center is here to help small businesses throughout the entire Bahamas. To better serve you, we've made it easier to contact us. Call 461-7232. WhatsApp 359-0626 or 359-2394. Email helpdesk@spdcbahamas.com or submit a ticket when you visit our help center at accessaccelerator.org. The Access Accelerator, empowering small business.
Always on the go? Missed the show? You can now listen to Guardian Radio talk shows anytime, anywhere on Spotify and YouTube by searching Guardian Radio 96.9 FM or by entering the name of your favorite show. You can also listen by logging on to GuardianTalkRadio.com and clicking on the podcast tab. Guardian Radio, continuing to provide you with fresh news and smart talk anywhere, anytime, all day.
This is Guardian Radio 99 FM. Fresh news, smart talk, all day.
Is in with me, Dr. Denothra Archer Cartwright. Thank you for joining me this Tuesday evening on Guardian Radio 96.9 for all things health, wellness, and things that pertain to the Bahamian society. Tonight, we're talking about common respiratory illnesses. We've got a lot of that going on right now. Kids, adults, everybody is kind of being touched by this in some particular way. So it's important to know what those things are, what we should look out for, and how do we take care of ourselves even before we get to the doctor. We last ended talking about pharyngitis, which is what we call our common sore throat. And for that, you just want to really take some over-the-counter medications, especially for pain. You want to do what we call an NSAID, acetaminophen, which is going to be an over-the-counter pain reliever, and that's really going to help for your throat to feel better. You want to gargle with some warm or salt water. And some people will require a little bit of steroids. For others, I do encourage a lozenge because it does have some pain relieving medication in it. And so that's usually what it's going to be. And rest, relaxation, lots of fluid, just like all your respiratory illnesses. We have a caller. Caller, you're on the air.
Yeah, good night, Dr. Archer. How are you doing?
I'm good, thank you. How are you?
Yeah, I recorded the whole show. I was listening most of the whole show. I missed a couple of minutes, and so I was just enjoying the information being dispensed, right? But I have about two questions, and I have a joke at the end, right? So I like it, but I mean, let me get the joke out first. You saw President Joe Biden's booster photographic psyops, right? I mean, come on, man. These people wouldn't give up Dr. D, man.
I don't know. I think I was joking someone. I says anyone down that road. I don't know.
Yeah, but I know you saw some response I made on the anyhow. The thing is, pneumonia is sometimes a secondary infection of COVID and pandemic strains, right?
Yes, it can be. Yes,
because I'm not really confounded, but I really learn from and I go by what I observe. So my cousin was in the hospital and he was put on the respirator or ventilator, but I know it was oxygen, but my aunt didn't get to tell me what scenario he was in. But they keep testing him, and he was tested negative for COVID, but they keep telling me he had pneumonia. So then, hence this confusion, even in the 1918 pandemic, when you read Dr. Eleanor McBain's The Poison Needle. Any doctor should read that. But the thing is, why I say that is because he actually died, right? And so,
oh wow, I'm sorry.
The bacterial infection, I mean them go up together. And the thing is, the bacterial infection seems to be more harmful to the lungs as far as the alveoli, the air sacs that you spoke about. Now, the thing is, there's a lot of hypothesis about mast cell activation syndrome as causing long COVID. And so, and listening to you talk, it opened up my mind with a more panoramic view, because I'm looking at the influenza and the coronaviruses, right? I'm looking at them as they progress. This COVID-19 excels in the upper respiratory and in the lower. So it's like it is mutating, or it's like somebody bordering it for it to really become more lethal. That's what I'm saying. Is some of these viruses that you spoke about, these are respiratory-like viruses, right? Some of them excel in the throat, and they don't excel in the lungs.
Right.
And so with COVID-19, it specializes in excelling in and also it is being proven now to attack the immune system itself, as Dr. Elena Chan hinted to in her book. And she also mentioned the fact that there's only a handful of these coronaviruses that affect humans. I guess it'd be the ones with animal reservoirs, but I think it's only 4 or 6 that she mentioned in the book. And so these people, you don't been studying these viruses for a long period of time, and so the truth is not getting out there. So I really would like for you to really, sometime in the future, to do a whole this thing on mast cell activation and long COVID. You see, because the mast cell is a part of the immune system. All right, and we still need to bring the truth out on this whole scenario. As you saw on the chat, right, that the only way to achieve herd immunity is not to vaccinate our children. And so this fact about non-specific and specific antibodies, this is a simple concept that anyone can learn and realize that the reason why they call non-specific is because they proliferate in the center and the upper and the secondary lymphatic system for specificity. So this is how your body has the ability to fight these variants. And so, I've been looking at it for a while, and so the fact that cross immunity is the only way to establish herd immunity. All right, so you cannot establish herd immunity if the vaccination is being proven, like Dr. Goetz said, with mutagenic escape, viral immune escape, the vaccine has been proven to pacify the non-specific antibodies and just deal with a specific strain. And hence, the non-specific antibodies become pacified, and then they don't activate, and so you lose the ability to fight any variant. And this is being proven by all kind of people, but yet we still have this farce of a commercial that this vaccine stops transmission power. Still, I don't know. They're painting a false external reality for I don't know who, but not for me. But
I think it's a part of the whole idea of mass formation psychosis, when you screen that it's green and then continue on in your way. So that I think that's where we are right now, whereas you have to determine the reality that's in front of you. Are you going to listen to what's being said, or are you going to believe your own eyes? And that's really kind of the focus of real control. Because if I can tell you what you're seeing is untrue and just continue with my narrative, then you are susceptible to a lot of things.
Yeah, but I'm suffering because before Dr. What's his name, Malone, he said mass formation, but I originally know this as mass psychosis or conformity, and so I'm looking at
there's mass formation psychosis.
I'm looking at suffering, majority tyranny. I read philosophy also, but the thing is, and I hate Dr. D. There's a lot of people who think this is all about knowledge and who's smarter than who. And I'm very sick, and they've been calling these talk shows and trying to defame my character, saying I just hang up the phone and call everybody dumb, right? Now, I was hoping, this is the second time they did it, I was hoping that they gathered this footage, this clip from the Guardian Radio and see me doing, because I can't remember, I can't recall. I remember calling myself dumb, I remember calling myself a sheep, and things like that. But I don't understand it. Why would I? How could I say that? How could I say everybody's dumb when I didn't say that? That's the one why.
I stopped worrying about what people think a very long time ago. But 30 seconds, 52. You got 30 seconds. Wrap it all up.
Yeah, but calling Guardian has benefited me, because when people see me, give thanks. Yeah.
All right. Thank you. Thank you. Always very engaging comments. Thank you for that. All right. Citizens for a Better Commonwealth. Good night, Dr. D. Did you see the court's ruling in New York? Yes.
If you'd like to make a call, please hang up and try again. If you
might have missed the first few minutes of the show, I kind of just touched on that gently. I didn't go into it deeply, but I did mention about the court ruling, just kind of the fact that they're recognizing that the fact that the vaccine, and this, if now it's mainstream, we can say it, the vaccine does not stop transmission, and Pfizer executives have actually admitted that they never tested for that. I guess the court ruled in the favor of those workers who were terminated because they did not get the vaccine. Because as we look back on it, truthfully, there was no purpose for it, and it was just forcing people to do and put something in their body into losing autonomy. And so with that, people are now going to be winning cases if they were subjugated to that type of behavior. Now, we'll see. We were pushed to really do that, but we're also going to have to look to see what's going to happen with the college students as well. So those are some big cases. There are also a lot of cases going on with the military in the United States that I haven't really tapped into. I have a lot of information on that, and I know a lot of people who are involved with having those cases going through, but I don't want to get too deeply into all of that because it really is a lot. So we're going to finish off this topic. And then maybe go into that. So I just want to touch a little bit. Sinus infections, very common. A lot of people, they are known to have some inflammation or sinusitis, and this can also lead to what we call sinus infection. It's a very common problem, and it happens because there's inflammation in that area. And that's because your sinuses, which are very hollow, and they're located kind of like below the eye and the side of your nose and in your face, they're little in your bone. They can get infected or they can get inflamed. And, they're inside your cheek areas, your forehead, above your eyebrows, on the side of your neck. Any one of those areas can get infected, inflamed, or congested. And usually a lot of these people will have what we call a postnasal drip. So some people will come in and say, Dr. Archer, sometimes, I'm coughing or I wake up at night and I'm kind of like phlegmy. That's usually a postnasal drip, and it has to do with your sinuses and whether they've been drained or if you have an allergy or something else that's going on. And if they're infected, you start getting this green mucus that's coming from your nose. You can have stuffiness and congestion. It can be quite uncomfortable and nasty. And so some people can have pain in those areas of their faces, especially under the bones below their eyes. And it comes with a bad breath, as well as cough, fatigue, fever, and headache. And sometimes headache is just kind of signs that there is some congestion or inflammation going on. So you really want to come in and talk to your doctor if you're not getting relief after a couple of days. It can usually last about 7 to 10 days. But if your symptoms seem to be getting worse rather than better after about 5 to 7 days, then it might be a bacterial infection and you would need. More common ones in children would be your bronchiolitis, your croup. That's the one where you sound like a seal, as well as air infections. There's always kind of a season when there's pink eye going around, sinus infections, and of course sore throats. Kids kind of pick up all kinds of stuff, and they tend to get bacterial streptococcus in their throats. So those are really common. And so the flu, when we say the flu, we kind of separate it out sometimes from the cold. The flu isn't considered really an infection because it could be kind of systemic. And this is the one where you would get like these body aches and these pains. It's more of really not feeling well, feelings of nausea, and it can affect both upper and lower respiratory systems. So the cold and flu have similar symptoms, but the flu tends to be more generalized to other parts of the body. And so the flu usually comes with this achiness, very high temperature, in addition to the respiratory symptoms that we would have talked about with a common cold. So it's like the cold on steroids, right? And you want to take the same steps that we kind of talked about. If you think you have the flu, it's going to be important. You also, let's just touch quickly as we're about to run out of time, but pneumonia. Pneumonia is basically a lung infection. So the symptoms can be similar to what you would have seen in a upper respiratory illness. You might have a cough, you're bringing up mucus. But you tend to have some other symptoms which are more severe, like your shortness of breath. You might have severe chest pain when breathing in deeply or coughing. And you really want to see your healthcare provider if you think that you have a pneumonia. And you prevent all of these respiratory illnesses by practicing really good hygiene, washing your hands, sneezing and coughing into a tissue and not your hands itself. This is why little kids get coughs and colds because, they're not really very hygienic. And they're in school, they're sneezing in their hand, they're touching toys and playing with their friends. And of course, as we always try to push, living that healthy lifestyle, drinking lots of fluids, getting your rest and your sleep, stop smoking because smoke impeded airways. And you want to avoid people who are sick. And if you yourself are sick, you want to stay home, you want to speak to your doctor, get some time off to rest so that you're not infecting other people. And so you want to keep up with your routine checkups. And if you're someone who's susceptible and needs like a pneumococcal vaccine, then you should do that. And you want to call your healthcare provider if your symptoms last really long, especially over 2 weeks, or if you have a high fever or any other concern. So children, you want to be specifically really kind of cautious with because they can change one way or the other. Older adults and anyone with any type of immune disease are going to be people who are going to be more prone to getting these infections a little worse than everyone else. And you can have various complications such as, loss of consciousness. And if you think that it's really severe, you're going to call the hospital or for an ambulance or take the person to the hospital themselves. And so that was a bit of a rundown on everything. And yes, citizens for a better Commonwealth Bahamas, yes, drinking lots of healthy drinks and immune boosting is really, really important. We encourage that with our patients. And so you can come in and get advice about that too. And that's really kind of a roundabout of all your upper and lower respiratory infections. So you want to be safe and keep yourself your immune system built up as much as you can, because we look like we're going into a bit of a crazy winter with these respiratory diseases, and kind of spread the word with your family. Keep a thermometer at home. That's going to be really, really important. So I want to thank all of you for joining me tonight on the Doctors In with me, Dr. Dee Archer, brought to you by Medical Concierge Services. We'll see you on Guardian. Oh, I have an announcement though. Next week, November 1st, the show will be starting at 6:30. We're taking Phyllis's old spot, so we're going up an hour. And I will post it on the page, The Doctors In with me, Dr. D, for more details. But we are moving to 6:30, and we'll have some promos going so that you're reminded. So thank you all for listening, and I'll see you next week at 6:30, Guardian Radio 96.9. Good night.